All right, looks like the additions have slowed down here, so we'll go ahead and get started. So welcome everybody to this installment of our Translational Science Seminar Series. We have two speakers today, Courtney Luking and Sarah Maxey. They're going to be talking about bridging research and real-world impact, partnering with cooperative extension. So just a brief background on our speakers. Dr. Luking is a registered dietitian and assistant professor and extension specialist at UK. In this role, she collaborates with students, extension agents, and community partners to develop, implement, and evaluate multi-level interventions that elevate the quality of nutrition and feeding environments during the perinatal and early childhood period. Dr. Maxey's expertise is also as a registered dietitian with previous clinical experience in pediatric diabetes and weight management, and is an assistant professor in the College of Dietetics and Human Nutrition. Her research interests focus on factors influencing adolescent and emerging adult eating behaviors. So with that very short introduction, I want to hand the floor off to our speakers today and welcome you guys. We look forward to hearing what you have to say.
Thank you, Joel. Hello, everyone. Thanks for joining on this rainy, dreary day. I'm excited to spend some time with you and walk through a project that Sarah and I started working on about a year ago. So Sarah, if you want to click to the next slide, we'll get started. Okay, so my role today will be to give you an introduction to extension. I will act as if you've not ever heard of it, so apologies for anyone who's slightly familiar, but I think it's really helpful to understand the system and structure before Sarah takes it over and starts to talk about the project that she's been working on with our 4-H and teens and youth with that. And we'll be talking about some lessons learned, and then we'll be available to answer questions and help you get connected if that's something you're interested in. Next slide. All right, so to kick us off, you may or may not know that the University of Kentucky is a land-grant university. And as land-grant universities, we are charged by the federal government to teach, to conduct research, and to provide service to communities. You may or may not have heard the phrase a tripartite mission. So that's that interaction between learning, outreach engagement, and research and discovery. And that's UK's mission, is to improve people's lives through those three factors. And cooperative extension provides a natural and unique opportunity to bridge those three areas of our tripart mission. Next slide, Sarah. A little bit of history here is that Cooperative Extension Service is housed in the Martin Gatton College of Agriculture, Food, and Environment. And it came to fruition related to an act signed by Woodrow Wilson in 1914. It created a cooperative extension service associated with each land-grant institution, and it authorized ongoing federal support for extension. So when we think historically, not everyone was able to go to university, and cooperative extension's role was essentially to bring the research to the people. Universities needs to generate research and translate it for benefit of their citizens. And through this, there are federal funds available to support services, as well as states providing some matching funds. And in Kentucky, we have a really amazing local investment, county level into our extension programming. And so when people ask me what my job is, it is, because I serve as an extension faculty member and specialist, it's really to bring UK to the people and our programs and educational materials. The goal is that we are providing people of the Commonwealth with information and skills and motivation to help them change behaviors that modify their situations and ultimately improve quality of life. And our programs address issues or needs in each community, which can be a bit different, as you might imagine, in Paducah compared to Lexington, compared to Pikeville. And essentially, no one size is going to fit all. Next slide. The land-grant university system is strong. What I want you to take away from this map is that there is a presence in all 50 states and US territories. So a real opportunity to leverage partnerships across the US if that's something that you might be interested in. This really shows that cooperative extension has unprecedented reach. And particularly in rural areas is where we see a primary benefit is that they serve as the local go-to resource for all things. Next slide. At UK, we have six what I would call key programmatic areas. What are those main areas of emphasis? We have agriculture and horticulture. We have forestry, family and consumer sciences, which this is anything from household equipment to sewing to nutrition to substance use prevention, recovery, and financial resource management, and anything in between. We also have a community arts program, which makes us a little bit unique in terms of the extension world. We have Blueprint Kentucky, which has an economic and community development focus. And then we have 4-H, which is our youth-based programming. And a red thread through all of these is leadership development. Next slide. We have a lot of people that work in extension. Close to 1,000 people work in the system across the state. And so to help you orient the different roles and who you might want to or need to reach out to if you're interested in working with extension, we have administrators that are located on campus, like our dean, who's also the vice president of land grant engagement. And we have an associate dean and director for extension. We also have program leaders who oversee, for example, the agriculture and natural resources, the 4-H, the family consumer sciences, and the community arts. Then we also have administrators out around the state, the regional directors and the area directors. And I bring them up because as someone who's done research quite often with our extension folks across the state, we cannot do anything until those regional and area directors are in the know of what we're doing. So the program leaders and then the regional and area directors, not that you'll have to necessarily correspond with them directly, but through the chain of command, they need to be aware of our projects before we can do anything. Then we think about this category of experts. That's where folks like your faculty and your content specialists and associates who are also specialists and tend to support the activities of faculty members and specialists, where a lot of us are located on state in Lexington, I should say, on campus, but we also have folks spread out about throughout the state at various research stations, for example, one in Princeton, and then out east as well. These are the folks that you may or may not be working with currently, but this is an example of how Sarah and we're housed in the same department. And so it was a really easy, natural opportunity as Sarah was a new faculty member and she shared this grant idea, this course. I'll let her talk more about it, but a CCTS pilot mechanism. And I had the connections through extension, and through that, we were able to kind of facilitate getting the right people on board and getting the necessary approvals to do it. So a faculty member or a specialist can be a foot in the door, and we'll talk about where you can find those folks. And then we also have educators. These are what I like to call our local go-to conveners. They're educators. They bring the community together. They are jacks of all trade. And I can't say it enough that they are the trusted resources. And so those are the folks that we are working with at the local level when we're doing programming and or research or some combination. You'll want to reach out to people on campus first before, so it's a faux pas to reach out directly to our agents to see if they want to participate in a research project. And part of this is just to ensure that we're protecting their time because they have a lot of demands, just like faculty on campus, we wear lots of different hats. They do as well. They might be the financial person for their county office while also having to do programming and scheduling and all of these and reporting. And so we want to be mindful of their time. And then we also need to ensure that there's a mutual benefit between what is being asked of the community and what is being offered of the community. And so these are all the folks that will in some way, shape, or form need to have input on a project. Next slide, please. Extension's role is, I would say, more recently really taking a stronger lens through health. Not that UK Extension wasn't focused on it before, but in recent years, there have been initiatives, for example, the Advancing Kentucky Together, One Health initiatives, charge from the Board of Trustees for Extension to really step up and facilitate partnerships in spaces to meet the healthcare, not healthcare, but health needs of our state. while this has been going on, there's also been a national movement with cooperative extension to really leverage the access and reach that extension provides. And so the quote that you can see at the top is that extension can do for the nation's health what it did for American agriculture. So really looking at a way to leverage this opportunity to influence healthy and safe choices, healthy and safe environments, and really working strategically with partners on campus, beyond campus, and at the local community level. Next slide, please. The overarching mission of UK's extension aligns with healthy lifestyles and disease prevention. So cooperative extension in Kentucky serves as a link between the counties of the Commonwealth and the state's land-grant universities. So we are a land-grant, and then Kentucky State University is also part of the cooperative extension service in Kentucky. And our charge is to help people improve their lives through an educational process, focusing on their issues and needs. And I will say it's not just education alone. Like, we're not just always doing classes. We're not always just doing dissemination of information. There's more upstream systems work, policy work, environmental work at the local level. Next slide. We are organized in 3 regions. I say this because I'm joking with folks who work in different areas. The regions in our state never overlap. So our extension reporting regions aren't the same as like public health or mental health center clinics across the state. Or I do a lot with our early childhood networks. Their regional maps are different. And so all to say, we do have our own organizational system. And so if that might influence how you think about your sampling approaches or which communities you're working with, for example. One more thing I want to point out here is that Kentucky has a really unique model that we are hyper local. So each of our 120 counties in the state have a brick and mortar office, and they have personnel. So those educators, the agents, as well as assistants. The size of the offices really is dependent upon kind of the total investment of local resources, needs, and the like. Next slide, please. I just want to show you, to reiterate, that each county has differing resources and capacities. So some county extension offices are on a floor in the county courthouse. Some have beautiful multi-million-dollar buildings. And so again, it really is dependent on the local community. And if you are interested in seeing kind of what each community or county is like, you can scan the QR code. We have the first one towards the left is county offices. And then I mentioned that cooperative extension needs to meet the local needs. So if you scan the QR code on the right, that takes you about every 5 years, we do a community needs assessment. And so it's reflective of input from each of the 120 counties across the state. The top priorities are identified statewide, but you can also drill down at the local level. So if you're interested, again, in a specific region or area or even community, you can look at what their priority needs are and really try to match with maybe what you're interested in or what you have to offer. Next slide. And then just really quickly, I mentioned that we're not just doing like a program where it's a lesson and then the people go home. Sometimes we're doing series of events. Sometimes we're participating in one-time events. We have a lot of work going on with health coalitions. So that might be a way to kind of get integrated with partnerships happening at the local level. Some one-on-one interactions. I, as a faculty member, am available to answer questions that agents get. And so I think we had one recently. We've been having a lot of questions about GLP-1, for example, or alpha-gal syndrome, or when the cicadas were out, like, is it okay to eat cicadas? I mean, the range of questions that we get is truly wild and sometimes beyond what I know about. And so that's why we have a whole team. We have a lot of written information. So that's kind of an idea to think about of deliverables that could be created for communities. Technologies, so we have a variety of podcasts affiliated with our extension, social media accounts, YouTube channels, you name it. Extension is out there to disseminate evidence based, research informed information. So that's just a quick and dirty about Extension, kind of how we're organized and how we work within the state. And I'll toss it over to Sarah now to give a little bit more practical example to put it all together.
Thank you, Courtney. So I wish kind of starting with an example of doing research with Extension, all that information that Courtney just shared would have been really useful kind of before doing the proposal stage. And full transparency, I learned a lot of that after. So hopefully we can kind of help connect those dots for anybody who's less familiar. So I'll be going over our study, our project, as an example of doing research with in collaboration with Extension. So this study, for short, we call it VR for Teens, but it's piloting an immersive virtual reality program with adolescents living in rural communities. And really just want to highlight, not to kind of give the plot away too early, but just emphasizing and highlighting one of the keys to the success of this project has really been learning how to foster a mutually beneficial relationship. So from me as the research perspective, Courtney as Extension faculty, and then other stakeholders along the way, how we work together to create a study and a project that helps everybody. So to borrow from social media, the meme of how it started and how is it going. So I'll start with how it started, and then before we wrap up, I'll let you know how it's going. And it started with an idea. So I was brand new faculty almost a year ago, a little over a year ago. And I had taken an idea, had an existing idea from my graduate and postdoctoral work about immersive virtual reality nutrition programs. And I'm interested in behavior. I have a clinical background. So taking this technology to use out in the communities is really what I wanted to do. And I had two sort of primary research questions related to virtual reality. So taking nutrition behavior research out of the lab, and then also using that technology to reach hard to reach communities. Teenagers, I think, no matter if they're urban or rural, are a little hard to reach. And then really engaging adolescents in nutrition education through this technology and what that technology can offer. So just to kind of lay a little bit of groundwork, if people aren't familiar with virtual reality is an umbrella term that can mean a lot of different things. So even computer games, anything within the computer can be a virtual environment. But what sets this virtual reality differently than other types is the immersive quality. So these are MetaQuest headsets shown in that picture, and those are the headsets that we use for this project. So this creates a 3D environment that the user is able to be immersed in and manipulate objects. So it really takes you out of time and space. And I'll show you some example pictures and videos so you can kind of get a feel for what that is. So we had this idea, and then a funding opportunity came up with CCTS and CORS that I'll talk a little bit more about in a second. And so kind of how do we put this idea out into the community? And that's where Extension came to be. And that's where I kind of leaned on Courtney as Extension faculty to figure out how is this going to work? Is this possible? So a little bit about the virtual reality programs we have to kind of connect the dots and why this works so well to integrate into 4-H or to test these programs out using 4-H. So I had access to two immersive virtual reality programs that had been previously tested in adults. So we had a buffet and we had what we call a digital dietitian experience. So to talk a little bit more about the buffet first. So this virtual buffet was designed from the University of Maryland, and they designed it after a real world campus dining buffet experience using images of foods. So the foods in the buffet are to scale, to size, and look fairly realistic, as realistic as a computer generated image can look. And the images sort of don't do it justice. When you're in the headset, everything does look a little bit more real. So this is a photo comparing the real world and the virtual buffets together. And then a study that I was involved in used the virtual buffet as a way to kind of compare to real world intake. And so the correlation between what people chose in a virtual buffet was highly correlated with how much they consumed in a real world meal context. So kind of this study helped validate virtual reality as a tool to measure eating behavior. So we have sort of our portable virtual nutrition behavior lab ready to go. And to give you an idea of what that looks like as the user, so this is in the buffet. You can pick up a plate and you can grab food from the buffet and create a plate of food. So the prompt that's given is to create a plate of food or a dinner or a lunch meal that is something similar to what you would normally consume or what you might want to consume. And so there's lots of manipulations that could be layered within this environment. But the users can play, they can pick things up, they can change the size and move around. So when you're in this buffet, you kind of lose all sense of where you are in a room. You are immersed in this environment and you can manipulate objects within this environment. So the buffet is really getting at research, being able to answer research questions. It could be applied to education, but we also have access to a program that was designed specifically for nutrition education. So the digital dietitian has also been tested in adult and was found to be effective and an enjoyable learning experience for adults. Kind of on these measures specifically related to the immersion in VR and being able to manipulate objects in VR as sort of a tool for learning is what we were really interested in. And so this was designed for adults, tested in adults. So the question that I had was, is this a viable mechanism to teach adolescents? Are they interested in this content? Are they interested in using the technology? Are they able to use this technology? And just a little bit of kind of the lessons within this digital dietitian are very hands-on and interactive. So it goes through concepts like portion size and energy density, some things that can be a little bit more concrete, some things that are a little bit more abstract. It allows for lessons to be very visual, very interactive, and hands-on. So this is a comparison of kind of portion size of different amounts of fries and how that relates to how many calories are within that portion size of fries. And so I knew I wanted to reach teenagers, and I knew that I wanted to reach rural communities to try to help bring what we do on campus to communities that are hard to access, who aren't probably going to drive over an hour to get to campus to participate in research or education using some of these technologies. So I was aware of 4-H. I knew of extension in the abstract sense, but I didn't know all the details. So I went to Courtney with this idea and kind of just asking the question, can we do this within 4-H? Because 4-H serves youth and they have a pretty large adolescent group within their clubs. And borrowing from 4-H's website, some of their missions and the way that they go about education seem to be a very natural fit. So within 4-H, they are meant, where their mission is to develop young people. So to develop skills and leadership to make them beyond ready is the quote that you can find on 4-H website. And then part of that is their program areas. And one of their program areas is healthy living. And I borrowed this again from the website listed there if you want to look at kind of more details. And so I thought that these programs might help achieve some of this program area mission or curriculum fit. And so going to Courtney and asking her the question, kind of how do we do this? How do we implement this within 4-H? So we had our idea. We had a funding opportunity to make this idea happen. I reached out to Courtney, who was very gracious enough to let me bring her this idea with not a whole lot of time to get it together. And then she really kind of set the track to move forward. So really talking about working through the system, what needs to happen to be able to do programming or do research within 4-H and extension more broadly. And what was really helpful was having that extension faculty who understands the system, who understands the background, who knows the people, and who to reach out to and what kinds of questions to ask. And then just from the proposal standpoint, so applying for funding, drafting aims, what was also really helpful was crafting aims that include extension and not just kind of layer my own aims onto extension. So reworking some of those aims to make it very clear that a goal of this project is to benefit extension, and specifically for this project was to benefit 4-H. So it kind of broadened out my idea a little bit. It changed a little bit of what we were going to do, but overall, I think it led to a much more rich, meaningful end product. So working through the system, knowing who to call, and then within those conversations, when we talk to people, more information, especially from logistical side, was really helpful. Understanding how the agents operate, what their scheduling demands are, when we need to get information from them. A really important thing that came out of some of these conversations was around recruitment and what does that look like? What do we need to think about in terms of recruitment? What we can ask agents to do and not do. And then just getting buy-in from all levels. Leadership down to the agents, I think was very helpful and important to have somebody to kind of guide through that system. So kind of taking the idea, making the connections, working through the system. And as we worked through the system, kind of reflecting on that process that happened a year ago, I think it was really a growth of the idea to be a mutually beneficial. So not just my own question of how does virtual reality education play out with adolescents and answering that research question, getting my data, and then walking away, but how does virtual reality, how can it be integrated within 4-H program? How does it meet their needs more broadly? So just kind of looking at it sort of from a circular kind of outward diagram here, starting with 4-H. So 4-H as a big organization, what are their program area needs? Luckily, there was a program area that fit very nicely with the existing programs, VR programs that we had. So that worked out pretty well. Kind of if I would have known ahead of time sort of thing, I think these would be good things to know ahead of time to know how certain ideas and projects may fit within 4-H specifically, or also other extension type programs. So knowing what types of content, what types of curriculums and program areas there are, and where ideas might fit in would have been very helpful. Luckily, it worked out for me to not know that ahead of time, but that would be something I would kind of recommend looking into in that idea development phase. And then also a big one when speaking with the 4-H folks was feasibility. How I envisioned things working was different, not wildly different, but different than kind of the feedback I got from people who are well-versed in how 4-H functions. So that was really helpful to kind of iron out some of those logistical details and set up for success when we actually get to the county. Things like Wi-Fi availability or reliability, having backup systems, how do we communicate with parents to get consent, all of those logistical things, very helpful to have those conversations on the front end. And then kind of underneath the 4-H umbrella is kind of answering that more specific question around teens. So teens make up a good portion of the 4-H participants in clubs across the state. So kind of answering outcomes that could be useful to 4-H clubs that serve teens. So questions like engagement, what are learning outcomes that can be accomplished through virtual reality? What are they interested in? So trying to frame sort of my outcome of a feasibility and acceptability with adolescents in terms and outcomes that could be given to 4-H so they can kind of inform their own curriculum needs. And then finally, the agent perspective. This was an area that was really added to by conversations with Extension and 4-H folks and Courtney as the Extension faculty. How do we integrate the agent perspective and buy-in into this overall arching research project? So things that were added to the proposal to the project were a needs assessment statewide. to get an idea if we're going to use virtual reality more broadly, not just this program in this context, what would need to be in place to facilitate that. And then specifically to 4-H and to the counties we visited, we added focus groups to get a more in-depth picture of how do they see this functioning within their clubs? Was it well received? What would they change? Just kind of get a more rich data on the agent perspective. So it kind of helped layer these three components of the project to come together. And then to end on how is it going? So this kind of started last year from the proposal, the funding stage, working through that, getting funding, which is always great, to then logistics and boots on the ground and actually getting the project off the ground. So again, a lot of communication that happened back and forth, getting counties involved and excited about the project, and then going out to counties. So far we've visited 2 counties. Because of crazy winter weather, we're actually doing a third today that was supposed to happen back in January, February, which didn't. So we've got 3 that we're gonna be done with as of today, and then we have more kind of coming up here in the spring. So we're kind of working our way through our county sites, and so far a lot of lessons have been learned already from the entire process. So just to share some lessons that I have learned through this that are hopefully helpful. And I will just preface to say that this is not unlike community-based research. So if you are a community-based researcher, probably a lot of these lessons you already know. And I don't come exactly from that world. I'm learning. So some of these lessons I have learned in just learning how to do community-based research, but specifically kind of within extension, I think it's understanding the systems and who to go to. So early and clear communication with county sites. So beyond going through leadership and then getting the approvals, going to then recruitment. And so sending a mass email out to our county sites, do you want to do this? And then we get some emails back, yes, we do. And so some of the things that I kind of learned after the first 2 were to really clearly communicate what I needed and what their facilities look like. So as Courtney mentioned, each county site physical space is different. So really understanding what that looks like depending on what your project might need in terms of physical space and supplies and things like that. So I've honed it down a little bit. I know what to ask better, and I know what to communicate what I need now that I've been to 2, but each one is different. And so because of that difference and because of being out in the wild or the community, there's a need for flexibility while also maintaining study rigor. And so I think this is where the need for pilot testing and sort of that first stage of pilot testing with some of these projects is to test out some of the feasibility and logistics and have those be the primary outcomes because of some of the variability with working within the counties. So that flexibility, just to kind of give an example of that, the first county I went to was in a pretty small space, and their club was split between adolescents, which are my target population, and younger kids. So we were in one small room doing 2 separate things. So not a lot of space to move. Noise levels were kind of challenging. So not that that could have been changed in any way. The space is what it was. But being able to flex and meet the needs of that specific environment to kind of get the data I needed collected. I learned that lesson at that site. And then also kind of gauging interest and then follow up. So we had high early interest in the program, which I found with virtual reality, people tend to be interested in virtual reality. And then really kind of capitalizing on that interest to get our project on their schedules. So like Courtney mentioned, the agents are really busy. They have a lot going on. They schedule pretty far out in advance. So really taking advantage of opportunities to communicate with the agents and then sort of jumping on that interest to nail down logistics and scheduling. And then how to distribute surveys to agents. We talked a lot about emailing parents. Do parents need paper copies? So kind of using the agents as they know their community, they know their people, and kind of going to them with the question of how best to do this. Here's what I think will work, or here's what I need, but what will work best for your club, your community. So of course, abiding by IRB approvals, but also working with the agents to meet their individual needs. And speaking a shared language, I think I'm guilty of this. I speak my research speak, and then community program speaks about the same thing, but just in a little different way. So this has come up in times of recruitment and sort of sharing about the project. Had a little mishap where it was shared on social media, which we didn't have IRB approval for. And it was fixed, it was fine, but just kind of knowing, oh, I've got to clearly communicate what are the boundaries of when I say share and advertise, what does that exactly mean? And then in terms of recruitment and getting consent, what does that mean in the context of a study versus more like parental permission slip that would be more applicable to like a program. So just kind of learning that shared language. And then I think my biggest takeaway for working with Extension has been very rewarding and meaningful to do this work within the counties and working with people that are enmeshed in communities. But if I had to go back and do it over, I would develop relationships early and really seek to learn about Extension as much as possible to be ready when an opportunity arises. So it worked out. I had an idea, I had an opportunity, everything worked out. But kind of the more I know now, I think I'm more ready to jump on opportunities as they come up because I understand the extension system a little bit better and I know who to ask and who to go to with questions, which I cannot state it enough how helpful having that extension faculty member, mentor, and contact was for this type of project. All righty. So that is how it's going. And I'm going to hand it back over to Courtney to tell you about how, if you're interested in working with extensions, she'll give you the how to do it the right way version.
Thank you, Sarah. So yes, if this is at all interesting to you, I appreciate that Sarah nodded. Getting introducing yourself is a great place to start, even if there's not a funding mechanism yet. I don't know about you all, but I keep, at least in the last 6 months, finding myself in very quick turnarounds for grant applications. And so to Sarah's point, having really strong foundations and relationships established up front can make it easier to quick act on those quick turnaround grant timelines. So starting with campus collaborators. Clotis Johnstone, she is our Assistant Dean for Extension Health Partnerships. Part of her job is to help make connections between people looking to do health-related work and with Extension. So she would be a great primary contact just to say, hey, introduce yourself, get to know her, and then she could always connect you with people beyond. I'm also happy to serve as a liaison and try to find best connections as you can. But to Sarah's point, kind of that idea generation, and then they can help facilitate working through the system. The administrative levels will want to see IRB approvals, but I would say don't wait until then. I can give examples of where somebody came, even people that I work closely with, they came a week before a grant was due and they're like, we want a letter of support from Extension. And that was just not, it was a no-go. So the point is to be intentional, not to have it as an add-on. And to Sarah's point, that speaks about any community engaged, community-based work. You want it to be reflective of those shared goals, and that everyone is on the same page and has clearly defined roles. But yes, before you can get started with anything, then administrative approvals, sometimes that requires additional presentations. Even as an internal faculty member, I'll say I've had to do several internal presentations to get buy-in for what I want to do. And then, so it can take a little bit longer. The point there is to build in buffer time, just because things change, things happen. So priorities, for example, mine fell down the priority list, which is totally understandable. And so being able to bring it back up. And then just thinking about the advantage that this has to facilitate bringing your work to the benefit of the people in the local communities, which I imagine is why many of you are on the call today, is thinking about how to expand the reach of your work or to do more community engaged work. And so thinking about how to bridge the work that you do in a way that can directly benefit people, regardless of the phase or stage that you are in your research trajectory. And I think that's all we had, right, Sarah? So happy to field any questions or comments that you all might have.
I'm curious how often you will end up coordinating with AHEC centers. If that, I mean, the regions are quite different, but the goal of being health focused, community engaged, community based, either interventions or assessments. Do you find that you all collaborate? Do you find that your funding isn't as compatible?
Great question. I can say that I honestly can't speak to that level because that is above the work that I do. But our dietetics internship folks, we work with AHEC. So a little bit different lens, not extension, but I would be happy to connect you with a person who could answer that question for you. Because it's not to say that we don't, it's just that I've not been a part of any projects that do. So it hasn't been me to facilitate that. But thanks for bringing that up.
Thank you. Joel, can I jump in real quickly?
Absolutely, Tom, go ahead.
So thank you very much for this very informative and really an exciting project. The folks having the opportunity to collaborate with integrated colleagues from the university that are spread throughout the state is such an exciting and fun resource to consider. Can faculty, if that are potentially interested in working with you, is it possible for them to just schedule a time to talk about their projects and kind of get your feedback on, what can be done, what might not be as so easy to do, and how best to sort of conceptualize integrating with the group?
Yes, absolutely. So I think Clotis, her contact is on there, or I also shared mine, and so would be happy to facilitate who, if not us, connecting with the best person that would be to provide that feedback.
Thank you.
I think the only question I would throw out based on Hannah's is, what is AHEC?
Now I'm going to second guess myself. What comes right off the tongue is Area Health Education Coordinators.
Okay. Okay. I was not familiar with that
Centers
acronym.
coordinators. Yes.
I think it's something like that. And so that is really interdisciplinary from what I understand. I know enough to be dangerous, but like I'll be going to their professional development conference this weekend. So bringing allied health fields and medical professionals, educators, and practitioners together to support that interdisciplinary collaboration.
Oh, nice. Okay. Very interesting.
They do a lot of work to help train future medical professionals. They do a lot of outreach and bridging programs to high school students as well, and college.
Yeah, they facilitate housing and clinical rotations and credentialing for a lot of different rural areas, and it's very interesting. I mean, the funding is I know nuanced. That's about all I know, to be dangerous also. But they have a lot of outreach events that we participate for the PA with the PA program. And so it just is a really cool idea if we're talking about educating adolescents. They also have a lot of outreach events in which they try to engage high school and middle school students. But anyways, that's yeah.
Thank you. I made a note of that. I'm gonna have to check that out. Good to know.
All right. Well, folks, if there are no additional questions, I'd like to thank our speakers today. That was very informative. I know getting involved with Extension has been something that has seemed to be a bit tricky. And so seeing that it's moving forward and there's a path for everyone is really exciting. So with that, Enjoy the rest of your afternoon, folks. And again, thank you so much for the talk today.